Before you do anything else, hold up your hands and look closely at your fingernails right now. Take just a second to really look at them. What you are seeing is something most people over 60 completely ignore, yet it can quietly reflect how well your heart is pumping blood through your body. You might think your nails are just cosmetic, but doctors often notice early circulation and heart strain signals right here long before any serious symptoms appear. Our bodies have clever ways of sending us messages, and our hands are like a built-in warning system. When your heart has to work a little harder to move blood to your fingers and toes, your nails are often the very first place to show it. By learning what to look for today, you can catch these tiny changes early and take control of your health. Your fingernails are not just dead keratin, which is the tough material that makes up your nails and hair. Instead, they are constantly fed by tiny blood vessels hiding right beneath them. Because these vessels are so small and sit so close to the surface, they act like a window into your cardiovascular system. When your heart is healthy, it pumps fresh oxygen and rich blood all the way to the tips of your fingers, keeping your nail beds looking pink and healthy. However, when the heart struggles or grows weak, your circulation naturally slows down to protect your major organs. Because your fingers are far away from your heart, they are usually the first places to lose that strong blood flow. When this happens, your nails can subtly change in ways most people never connect to heart health. They might grow slower, become brittle, or even alter their color, but most folk just blame these changes on getting older. The truth is, your hands are trying to tell you a story about your inner health, and some of these signs are shockingly easy to miss. Over years of observing patients, healthcare professionals often notice a pattern. People with circulation issues or heart strain sometimes show early changes in their nails long before they ever feel serious symptoms like chest pain or shortness of breath. Doctors and nurses are trained to look at a patient's hands the moment they walk into a room because the fingers tell secrets that the rest of the body might be hiding. It is a simple check that takes only a few seconds, but it gives medical experts a great clue about what is happening deep inside. Now, it is important to know that not every single case means something dangerous is going on. A dent or a spot on your nail could just be from a minor injury or an everyday bump. But the pattern is consistent enough that it is never ignored in clinical settings like hospitals or clinics. When medical experts see certain shapes or colors across all 10 fingers, they know it is time to take a closer look at how the heart is doing. Paying attention to these patterns is all about staying ahead of the game and protecting your body before small issues turn into bigger problems. And the first sign is one most people think is just aging. The first clue to look for is pale or unusually white nails. Instead of a healthy color, your nail beds might look washed out and less pink than they used to be. This happens because of reduced blood flow or oxygen delivery to your hands. When a weakened circulation cannot push enough bright red blood to your fingertips, the area turns pale. Many people assume it is just aging or cold weather making their hands look a bit ghostly. To be sure, check if it stays consistent indoors when you are nice and warm. Don't panic, but don't ignore it either. Next, you should watch out for a blue or purple tint around your fingertips. This dark shading means oxygen levels may be lower than normal in your bloodstream. When the heart does not pump efficiently, the blood loses its bright red oxygen and turns a darker color, which shows through the skin. Don't panic, but don't ignore it either. Another important sign is spoon-shaped nails, where the edges curve up to form a little bowl. This unusual shape often points to a long-term nutrient or circulation imbalance. It means your body has been struggling to send the right materials to your hands for quite a while. Don't panic, but don't ignore it either. You might also notice slow nail growth. If you find that you rarely need to clip your fingernails anymore, it could mean you have a reduced metabolic or blood supply efficiency. Your body is saving its energy for your main organs and cutting off the supply to your fingertips. Don't panic, but don't ignore it either. Finally, keep an eye out for dark streaks or lines running down the nail. While these can sometimes be harmless marks, they require medical attention if persistent, as they can track back to deeper blood vessel issues. Don't panic, but don't ignore it either. This is where things get more serious. While a small change in your fingernails is a useful warning sign on its own, it becomes much more urgent when it starts paired up with other clues around your body. If your nail changes come with constant fatigue, swelling in your legs or ankles, or shortness of breath during regular walks, it may point to deeper heart strain. Your heart, blood vessels, and limbs are all part of the same big network, so a problem in one area usually ripples out into the others. Unfortunately, most people miss this connection until symptoms become much harder to ignore. They might treat the swelling as just tired feet or think their shortness of breath means they are just out of shape. They do not realize that their pale nails and swollen ankles are actually speaking the exact same language and pointing to the exact same issue. By looking at all these pieces together, you get a much clearer picture of what your body is trying to say. Stay with me, because in a moment I'll show you a simple at-home check you can do in under 30 seconds to see how your circulation is working right now. To check how well your blood is moving right now, you can try a very easy test. Press your thumbnail firmly for 3 seconds until it turns white, then release it. By pressing down, you are temporarily squeezing the blood out of those tiny vessels beneath your nail. Normally, the healthy pink color should return quickly, usually in less than 2 seconds, because your heart is actively pushing fresh blood back into your fingertips. If it takes noticeably longer for the pink color to rush back, it may suggest slower circulation throughout your body. This delay means your blood vessels are moving a bit sluggishly, especially when combined with the other symptoms we have discussed like pale colors or slow growth. It is a quick way to see how hard your system is working to reach your outer limbs. Please remember that this is not an official medical diagnosis, but just an early awareness check your body gives you to help you stay informed and mindful of your health. What should you do if you notice these signs on your own hands? The most important first step is to monitor changes over time, rather than just worrying about one single moment. Our bodies change from hour to hour, so it is best to look at your hands in different rooms and during different times of the week. Next, make sure to check for other symptoms like constant fatigue or swelling in your legs. If multiple signs appear together and stay around for more than a few days, you should prioritize a medical checkup with your doctor. It is always best to avoid self-diagnosing based on your nails alone, as only a healthcare professional can give you real answers. Your body rarely speaks in silence, and it uses small signals long before bigger problems appear. It does not want to surprise you, so it gives you gentle warnings ahead of time. And your nails may just be one of the quietest messengers you have been overlooking every single day. By turning your attention to your hands, you are learning to understand the special language of your own heart. Listen early and act early because that simple awareness can make all the difference in the world.